Welcome to the Southern California Medical Report. I'm your host, Eric Brown, and today we have breaking news, in this case regarding a dental miracle called the UltraTooth. I'm sitting here with Sargon Lazarov, the good doctor that is the inventor of the device that gives immediate tooth replacement with this dental implant. Dr. Lazarov, thanks for joining us.
Thank you for inviting me.
So if you'd be so kind, tell us, what is the UltraTooth?
Well, UltraTooth is the only FDA-cleared device that can replace a tooth in full function. That means that you can walk in the office, and if you have one or two or several teeth or all your teeth that have to be replaced, they can be replaced and you can walk out eating, chewing, smiling, and enjoying them right away.
That's great. And so for those folks that don't know, what does a typical client look like? What are the services that they experience?
Typical client is anybody that is missing a tooth or losing a tooth. There could be gum situation, gum disease, people that come, they have some teeth missing or they're losing their teeth, or some people that have lost all their teeth and they want to gain them back. And we see a lot of emergencies too, athletes, accidents, that occur, and patients lose their teeth and walk in with the teeth in their hand, and we just tell them that don't worry, we'll give you a brand new tooth. You can walk out and start chewing, eating, and enjoying.
And it seems like this is a revolutionary concept. So you've got a traditional implant compared to the UltraTooth. What's the major difference?
Well, traditional implants are screws. Screws that are basically, you drill into the bone and place the screw, and you have to wait 4 to 6 months for them to heal. And once they heal, you do another surgery to uncover the screw to see if it's worked. And when you determine it's worked, then you start restoring it, and patient's earliest time to obtain a tooth is about 4 to 6 months. Now, concept of UltraTooth was simple, where the question came to my mind is, when we place that screw, why not have an expandable screw which locks onto bone, where the patient can be using it and while the healing occurs, and the patient walks out with a tooth that is stable and functional immediately and very aesthetic. This device, has proven itself for 30 years. So it has proven itself long-term, and it's a very viable thing, and the FDA approval goes back to 1994.
Beyond implants, I oftentimes also think of what are the other options that I may have to be able to do any type of cosmetic or more structured repairs of my mouth. And I think, what about dentures? How do dentures come into this play?
Dentures are basically failures of dentistry. Dentures are when we didn't know what to do. Okay, when basically patient loses all their teeth, we couldn't do anything as far as implants and devices and everything, so we gave a piece of acrylic that had teeth on it, and you had to glue it or create some kind of suction, which with time it would put pressure on patient's jawbone, and the jawbone collapses and gets smaller and smaller. So patients that got dentures early in life ended up with a very small, fragile jaws that later in their life actually fractures. So I call those the failure of dentistry, and the goal of UltraTooth is to prevent everyone from getting to that point.
I think upon returning home after getting the UltraTooth implant, my wife and my son immediately recognized something was different. And not only was I smiling, but I was smiling that much more with my UltraTooth implant. And neighbors and friends and folks at my church also realized that something was different with my UltraTooth implant.
If I got the traditional screw implant, I knew that it was going to take from 8 months up to a year, and it was going to be painful. I wasn't going to be able to put pressure on my teeth at all. But with the UltraTooth, you can literally put your tooth to function the same day. You can eat the same day. I'm normal. I'm perfectly fine. I love the UltraTooth.
I had one molar that I knew had to go. I had a constant infection that seemed to affect the whole lower set of teeth. And I had front tooth that was so loose that it completely twisted, and the ones adjacent were loosening. And I would have nightmares every night and just be scared anytime I was in a crowd, and especially eating, that I would lose a tooth. But the very day after, I was proud to let the students know, and friends and family, that I was eating. That first night I had a lamb chop that I hadn't had in years, and it just was great.
Based on the way you described the process, I think it would be people coming from all over the world just to come here. But you had mentioned that there's over hundreds of locations that you have taught other dentists on how to do this practice in a certified fashion. That seems like quite the accomplishment.
Yes, as far as the training of the dentist, this has occurred in past 2-3 years. But previous to that, I have had and still have many patients flying from everywhere, because the time period of treatment is very short. So we have VIPs flying from other countries, coming in and staying in 1 week, 2 weeks, and basically replacing all their teeth.
So can people eat whatever they want immediately?
Absolutely. So, before we didn't have the technology where we could give the crown immediately. So we would do the surgery and give a temporary crown, take impressions, and have a lab make the crown. So in these cases, I would have the lab, do overnight crowns and things like that. But now we do have the milling technology. Well, actually, we can make the final crown for 1 or 2 teeth or smaller cases immediately. So yes, patients can fly in, get their teeth, a couple hours later, leave.
That's really impressive. So I'm sure some people are thinking, with a product that is this fantastic, it's got to cost through the roof. So how do people pay for this? How is financing done? How does the average person be able to acquire something so great?
So again, the good news is that because we have so many different doctors doing it, depending on the area, usually doctors adjust their price of an UltraTooth to like a 3-unit bridge. So if it's like a 3-tooth bridge, whatever it is in your area, that's typically what you're paying. But you got to remember, you're saving so much because, as I said, you're saving on the gum grafting, bone grafting, which traditionally goes in. With the traditional implants, patients call an office and say, what's the cost? And the cost, they say it's this much. But when you go in there, the doctor says, well, the tooth is not there. You've lost gum and bone and all that. We have to extract the tooth, let it heal, and then we bring it bone. And so all of those are not discussed. Once you add those, traditional implants can cost up to 2 to 3 times what an UltraTooth is.
Thank you, Dr. Lazaroff. As we all know, the FDA is extremely regulated, and getting acceptance on a medical device can be very difficult. One of the amazing things about the UltraTooth is the fact that it is the only device that has FDA clearance for immediate full functional load. Just another testimonial as to why the UltraTooth is so spectacular. Let's find out more.
The UltraTooth is an engineering marvel designed by Dr. Sargon Lazaroff, a practicing dentist and past clinical professor from the USC School of Dentistry, as a safe, lasting, and practical alternative to traditional implants. The UltraTooth has had a 510(k) clearance by the FDA as an immediate loading dental implant. It's been described as the first major innovation in dental implantology since the early work of P.I. Brennemark.
UltraTooth cuts down the process of implants from over 12 months to nearly 1 hour. Patients have overwhelmingly responded positively to UltraTooth because of its painless, quick, and effective application.
Welcome back to the Southern California Medical Report. I'm your host, Eric Brown, and with me now is one of Dr. Lazaroff's former patients, Dr. Jonathan Blinstrud. Dr. Jonathan, thanks for joining us.
Thank you so much for having me.
So there was at one point a pretty major incident in your life that introduced you to Dr. Lazaroff and his implants. Can you tell us that story?
Of course. So I graduated from the University of California, San Francisco. At that point in time, I was able to meet Dr. Lazaroff. My dad had received some dental implants, the UltraTooth, from him, so I knew about it at that point in time, and I was just fascinated with what the system did, because it doesn't have anything that relates to any of the other different systems on the market. Unfortunately, I was involved in an accident and I lost 4 of my front teeth. I had a fractured palate and my lip was lacerated. So what I did is I got in contact with the office. Days later, I flew from Arizona to LAX. I saw him. Within hours, I walked out with new teeth. It was nothing short of amazing. I have a great smile. I would say that I'm walking and living proof that it's an excellent system.
And how does one become an UltraTooth certified provider?
It's quite simple. There's a training course you go to. After that, there's a hands-on component, and then putting in information about the cases that the provider does.
That's great. And how would you say that the UltraTooth compares to traditional implants?
I would say the system is quite fascinating in the sense that you have a tooth, you take it out, you can have an immediate load implant. You can put a crown on it, walk away with a new tooth. Whereas other systems, you have to wait months, may have different augmentation procedures that are needed. And the thing is, with the design, you're not going to have bone loss or soft tissue lost either.
Thanks again so much for joining us.
Thank you.
Now let's listen to another patient who has had a life-changing experience and can eat without limitations.
For the first time in my life, I actually had someone say, "You have such a nice smile." I never heard that in my entire life. And finally someone said, "Hey, you got a nice smile." I felt like, wow, that made me feel wonderful.
I can leave now and go eat whatever I want for lunch. Don't have to worry about eating fruits that are already blended or processed, as in yogurts or applesauce. So I'm definitely looking forward to having a nice, basically either a hamburger or a steak for sure today.
So when I came in and actually had the appointment for the UltraTooth, I was extremely satisfied. I had no pain during the procedure, after the procedure, and you'll never know that it's not my own natural tooth.
I didn't feel one thing. They talk the entire time, making sure that you don't feel any pain. I never felt any pain through any of the procedures, and I had both of them done the same day.
You talk about the idea of the studies, the research, the amount of time that goes in to develop this product, and I've been wanting to know since we sat down to chat, where did this come from? What fostered the idea?
It's very interesting because, I traditionally started being trained in the traditional implants, and one of the courses that I was taking, this was in late 80s, I was sitting and the instructor was saying, talking about the process, and said, we place the screw and we wait for bone to grow and make contact with the surface of the screw.
Sounds painful.
Yeah, well, so the question came to my mind that what if I have a device that can expand and make contact with the bone at time 0, so we don't have to wait for bone to close that gap. A few nights after that, around 4 o'clock in the morning, I woke up and I got my wife up and I said, wake up, I think I have a good idea. So that was the start of it, and then I came back making prototypes and actually went to my dental school and took some jawbone cadaver bones and brought them to my office. First tried it like that, and then when I had a proper prototype, and I placed it on a friend of mine, the first implant in 1990, and that was the beginning.
We haven't really spent a lot of time in talking about gums. So it's a huge part of their mouth. Gums can be healthy, they can be infected, they can be aged, they can be brand new. How does this work with gum tissue?
Well, most of our patients are patients with gum disease. That's one of the prevalent reasons for losing teeth. So gum disease is usually a reaction to the bone that is around the old teeth, the natural teeth. As you lose the bone, the gums become inflamed and you see infections and all that. But the cause of that, and even like the root canal, endodontic failures, those again, the root becomes infected. The cause of that is that tooth. When we remove the tooth, sometimes it's caused some bone loss, but the gum most of the time has the same shape. It's there. It's just that there was a pocket underneath it and it was inflamed and it's red and it's reacting to that infection. But as soon as we remove that cause of the bone loss, the infection, and we put an implant that is sterile and we put bone there, within hours you'll see the gum relax and starts changing. I call it happy gum.
Wow.
You know, we get these angry gums, which is red. You know, it just wants to reject that tooth that is failing, and within hours, next day, you see the gums is just flat because it's no longer reacting to that infected tooth and bone.
That's pretty amazing. You know, when you bring up the idea of bone loss, and immediately that takes me to thinking of age. And as we get older, you think that we might have more problems or we need more maintenance. What you're describing makes it seem like there might not be age limits or requirements. You can be older and still be able to use this product. Actually,
the older you are, the better it is, because my oldest patient that I treated was 92 years old. I mentioned the word denture as a process, and he just turned around and cursed at me. I didn't come to you for dentures. I came to you for UltraTooth. And I pointed at his son. He says, "You see this guy here? I made him a doctor. This guy is going to pay for my teeth." Sure enough, you know, put him to sleep. Next appointment, gave him all his teeth. Woke up, and it's been like 6-7 years later, and he's still enjoying them.
Well, I want to come back because you had talked about affordability. Some people might even need to look at financing. Are there financing options available for the UltraTooth?
Absolutely. There's all kinds of financing. Actually, there's banks that finance all types of treatments. And actually, insurances now are covering dental implants. You know, if you go in for a single tooth and a doctor says, "Let's do a bridge," you got to stop, because taking two healthy teeth and grinding them and hanging a bridge off of that is just, forget it. That's just not done. I haven't done that in the past 25 years. But then the other choice is that dental implants, and then you want to question, you know, dental implants versus UltraTooth, you know. So cost-wise, it can be covered by insurance. It can be financed. We have patients that come in and finance their entire mouth. You know, you have patients that have car payments, $400 or $500 car payments, and they want a brand new car. There's patients that want a brand new set of teeth, smile, and they set up payment plans that, you know, they pay a few $100s a month and get all their teeth replaced.
So you had told me offline at one point that you had gone to the New York Dental Convention, was it? And you had a room full of dentists that are wowed now by this process. Talk a little bit about that.
Yes, you know, this was a tour that I did in past 2 years. We had a room for 400 dentists where actually, while I was lecturing, a live surgery was going on where a patient sat down and they had 1 or 2 teeth that had problems, taken out in front of this room and replaced, and right after surgery, the patient was given an apple to bite on.
The value of UltraTooth and the transformation of treatment for patients is that for the first time ever, they really have a the ability to have a fully functional loaded implant crown the same day the tooth is extracted.
Patients don't want to wait. They want that restoration done. They don't care about the procedures. In this, with UltraTooth, all I tell them is, I'll give you a tooth today. You want it? Yes or no? And the answer usually is yes.
By having an immediate replacement tooth system, you know, the way I do dentistry, it's completely different because I'm giving my patients quality instant results.
We don't have to go through that whole process of temporization with a flipper, multiple appointments. We're able to just deliver the entire prosthesis in one day.
So when we build a tooth as a clinician, we've got to have something that's stable. We want to have something that works. We want to have something that the patient can go chew on right now.
Now, as we go down all of the marvelous bullet points that this product have, I'm going to wager to say that there are other dentists that are watching this show right now and thinking, how do we get this into our practice? And what would you offer them? What would you tell them?
It's all they have to do is go online, and they have a step-by-step process. They can register online, They can see an hour lecture for free to see all the details of it. If they're interested, they can take an online course. They can go on ultratooth.com, and then after that, they go for a day or two of training, and then we monitor some of their cases when they do the procedure, and they're off and running.
So now, based on your expertise, at one point you were featured on a show called The Doctors on network television.
Yes.
And right there on the program, you were able to change someone's life.
Yes, actually we did this live surgery where they brought a patient from back east, and she had all kinds of problems with her dentistry and dental problems and emotional problems that were caused by her condition. And actually in live, right on camera, around 4 hours, took it, of course they edited it, but I reconstructed her entire mouth.
Oh my God. Thank you so much.
That's what you deserve.
You were my hero. You gave me my life back.
Well, now your smile fits your face.
Andy's here along with Dr. Sargon Lazaroff. And I want to remind everyone what Brandy's teeth looked like before. And Brandy, you wouldn't show me your smile when you came out here because you knew this was the moment of the reveal. So give us a big smile. Do you still have trouble believing when you look up there and see your smile?
Oh, yeah. Oh, yeah. I can't believe it. I keep going by mirrors, and instead of avoiding them, for once I'm stopping and looking and going, oh my gosh, is this me?
God, it's so amazing. Brandy, we are so happy that you're smiling now.
I know, I'm sure a number of our viewers have experienced that they go in and they might get basic dental services, but then to do any type of cosmetic services or any type of surgeries or anything beyond, it's a whole nother office, it's a different experience, it's another appointment. Do they have the opportunity under one roof to get imaging, the implants, the follow-up, everything?
That's what our centers do. At our centers, we basically do A to Z. Everything is done there. And the beauty of it is that they can come in and have all their dental needs met from UltraTooth to all kinds of services.
Now, you've talked a bit about the difference between UltraTooth and a typical implant, but what's the difference between UltraTooth in this idea of teeth in a day?
Yes. You see this advertised a lot. Teeth in a day is basically a denture that is screwed on your jawbone. And the gums and the teeth, you see these, they show these patients on commercials where they're smiling, where it's all basically acrylic, the gums are not yours and all that. So basically, everything in your mouth has to be taken out. And many times if you have teeth, once they remove the teeth, they have to take the bone that was around those teeth to make room for the this all-on-4 that is called. And then they place a denture with 4 screws, and that denture is shorter version, doesn't have the chewing teeth. And you're warned not to put pressure on it for a month and a half. And then if everything heals and everything is okay, later they give you a denture that goes further back and is screwed on, which is completely different than the idea of UltraTooth. UltraTooth, it's the same bone and gum that you have. We take the tooth out and we maintain everything and we put the tooth back in. So we can do 1 tooth, 2 teeth, and all your teeth. But with those techniques, all your teeth have to be taken out. So if you have 4 bad teeth, 5 bad teeth, they're going to try to convince you that in the long run, it's cheaper to take out all your teeth and have this procedure, which I don't agree with. If you're some older patient that has been wearing dentures and they've lost bone, no bone is needed to be removed, maybe a technique like that could be justifiable. We do that, but I make those dentures that are locked in removable so the patient can always take it out and brush the implants underneath and then lock the denture on. If some doctors want to screw them in permanently, they can, but I personally don't like the fact that patients cannot go in and clean underneath them.
So tell us about your new Signature Center in West Hollywood.
Yes, the Signature Center is basically where I talk about the art of dentistry. And this is where we provide all types of dental treatments, including the UltraTooth, but we really go into designing specific smiles for specific patients. Now, you know, I talk to my patients and they question what is the art of dentistry. And I tell them, well, you've heard about art of painting, and some people go invest millions of dollars and they buy this painting and hang it in their house to enjoy. I tell them that there's a painting in your face, which is your teeth, and the frame is your lips. And you're taking it everywhere with you. And the minute you open your mouth, you can be showing it off. And that not only helps you chew and eat properly, but it projects your personality. It immediately tells people, without talking to you, what type of person you are. So that design, as an example, I'll tell you that I give you longer canines. I can always make you look mean without you even knowing. So if I give you softer, larger front teeth, it's a very sexy smile. If I give you these laterals that are slightly overlapping with your front teeth, it's an assertive smile for salespeople. So we do that design specifically for you. Now, the part of the surgery and the placement of UltraTooth and all that, that's the root base and all of that. But the patients ultimately want to look good. You know, no matter what you put in there, the end result has to be customized for me, and I want to be happy, you know, when I smile. So that's where we come in and design smiles for you. And whether it's on your own teeth with veneers and crowns, or it's on UltraTooth or missing teeth. So we just reconstruct a brand new smiles for you. And we go a little further. Actually, the frame, which is your lip and the tissues around it, we're going to have specialists there that are going to be correcting that frame. So if you need little changes with your lips and all that, and you know, to make it harmonious and look good with the rest of the teeth, we do those procedures there. It's a very you know, selective type of treatment for certain people that are specifically looking for me to be involved in their treatment.
Well, Dr. Lazaroff, thank you very much. We've learned more than one could imagine about dental implants today, and it's been phenomenal. Thank you so much for sharing.
Thank you very much. Thanks for...
Absolutely. And thank you everyone for tuning in to this special edition of the Southern California Medical Report. Remember, if you have any interest in this incredible UltraTooth implant, or you are a local dentist that's looking to join the team and become a UltraTooth certified provider, log in to ultratooth.com to learn more. Again, I'm your host, Eric Brown. Goodbye.